Hello viewers, I am Dr. Shashant. I am a clinical andrologist at 49 Hospital, Sikandrabad. Today I am going to be discussing about the coronavirus disease, which is the pandemic that has spread to almost all the countries of the world and is creating a lot of suffering and anxiety. In India currently, the second wave has hit our country hard, and we are having a lot of strain on the healthcare sector. There's a lot of hospital admissions. So, what can you do to prevent acquiring this COVID 19 disease? I'm going to give you a few tips. So, the first thing is try to remain at home as far as possible and leave the house only for essential work. When you leave the house, just ensure that you are wearing a very tight fitting mask. This can be either a cloth mask or an N95 mask or a multi-layered mask, but ensure that the nose area there is a fold, so that should be properly pressed, so that it is a proper seal against the outside air. So wearing a proper mask, good fitting mask is important. Don't wear it just over your mouth. It has to cover your nose. Preferably, if you have a face shield or even some spectacles, that would provide an additional protection, because sometimes the virus, rarely it can enter through the eye, through the conjunctiva. Secondly, you need to wash your hands at very frequent intervals. If you have any latex gloves, that would be good if you're touching any surfaces. But if there is no gloves, no problem. You can use a pocket sanitizer or wash your hands using any soap for at least 30 to 40 seconds. Third thing is, you can do salt water or gargling using a betadine mint gargling. You can dilute this betadine mint gargles and gargle your throat every day 3 to 4 times. Drink warm liquids, stay away from cool drinks and sodas. The third important thing is you need to exercise and maintain a healthy diet. Please take good intake of fruits and vegetables and cut down on the fatty foods and deep fried items. The fourth important step against prevention of COVID 19 is maintain social distancing. Just ensure that you have at least 6 feet, 6 to 7 feet of distance between your adjacent person. Particularly, even if you are in the house and there are some elderly people or people who are predisposed to having a severe disease. For example, people with comorbidities such as diabetes or overweight patients or patients who have any lung disease or smokers. So just ensure that you do not come too close to contact with them, because they can have a very severe disease requiring hospitalization. Do not share any utensils or bed sheets, and ensure that all the surfaces in the home are cleaned thoroughly using a sanitizer, and don't share the same toothbrushes and bed sheets. So just ensure that whatever has been used, it should be washed with soap and detergent in water that is at a temperature ranging from 60 to 90 degrees. So the heat will be sufficient to kill the virus, if any. And just ensure that the surfaces are properly and thoroughly cleaned. If you can use 0.1% of sodium hypochlorite solution, that would be even more effective. In spite of taking all precautions, if you contract the virus and land up having symptoms, so what are the symptoms of COVID infection is, first common symptom is dry cough. So if you develop a dry cough, or if you are running a fever, if you are having weakness, restlessness, giddiness. So, and one more symptom is diarrhea. You can have loose motions. So, if you are developing such symptoms, please get yourself tested in a nearby laboratory. The name of the test is RT-PCR, reverse transcriptase polymerase chain reaction for COVID antigen. So, they will be taking your nasal, nasopharyngeal swabs and oral swabs, and you may receive this report in 1 to 2 days time. In that duration, you can consider yourself as having the virus, and please do not step out of the house uh, till the report is confirmed. Secondly, you have to stay away from the susceptible persons. Please wear a mask, and you can start yourself by consulting a doctor if possible, preferably by an online consultation, so that the doctor can prescribe you. In some situations, we are prescribing some tablets such as favipiravir, and in some situations, we are just giving multivitamins and symptomatic treatment. So, you need to do this. And what are the other methods that you can monitor your safety at home? So, first thing is you can buy a blood pressure monitoring machine. So, this commercially available. You can check your blood pressure at regular intervals every 4 to 6 hours along with your pulse rate. So, the normal blood pressure is in a range of between 90/60 till 140/90. So, above this and below this are sometimes they can be dangerous, and you will need to consult a doctor. Then the third thing is you need to check your temperature at regular intervals. So for this you can buy a thermometer, either a simple analog or digital thermometer. Check your temperature. So if you are having any repeated fever, that is temperatures above 100.4 Fahrenheit, for multiple episodes, so more than 3 times, it is not responding even to paracetamol, which is routinely prescribed for fevers and body pains. In that situation also, it is advisable to visit the doctor. Thirdly, it is advisable to visit a clinic for a general checkup in case you are having difficulty in breathing, or if you are having a portable saturation meter. It checks your oxygen saturation levels. So simple finger probe, it is a digital probe that will sit on the finger, and within a matter of few seconds it will tell you your heart rate and the percentage of oxygen. So it is not known as a pulse oximeter. In case your oxygen saturation levels are dropping below 95%, and if you are having any breathlessness or difficulty in breathing, this is also a red flag symptom to visit the doctor. One more classic symptom of COVID 19 is loss of smell, which is called anosmia, and loss of taste. So, if you are experiencing that you are suddenly not able to smell your perfume or taste your food, that could possibly be an early sign of COVID 19 infection. So just ensure that you are taking a healthy diet, you are at least having physical activity. Even if you are positive for the COVID infection, you should not take bed rest because of the chances of developing blood clots, which is called DVT. So COVID virus is known to cause abnormal clotting, due to which it is advisable to have physical activity of 15 minutes, even if it is walking around the house but away from other family members, at least 3 times in a day. And drink a lot of liquids and juices. You should have a good hydration. So this is very important. And then just ensure that in the prevention of COVID, you can just ensure that you are not having any habits. If you are in the habit of tobacco smoking or consuming alcohol, please try and reduce this to the minimum, because COVID infection can cause severe damage to the lungs in cases of previous history of smoking, or if you are having any other medical pulmonary diseases such as bronchitis or asthma. So such patients should be very careful when they are positive for COVID 19 infection, and be in a regular consultation with the doctor. And importantly, the vaccine, the COVID vaccine in India are provided by two companies. One is by Bharat Biotech, which is Covaxin, and the other is by Pfizer, which is Covishield. Both are equally safe and they are very effective. So the vaccine is proven to be safe across all the adults above the age of 18 years, and they can be very beneficial because they will ensure that the immune system is ready against this virus attack. So don't believe any misinformation, just read the correct news, the authentic sources of news, and don't spread any misinformation. Don't believe rumors. You can take this vaccine safely. Even if you get infected after the taking both the doses of the vaccine, even though you can get the infection, you will have a very lesser progress of the disease severity as compared to an unvaccinated individual. So now the newer studies are saying that it can be taken even by pregnant women. So just ensure that the vaccination should be taken very seriously. It can save your life. And everyone, please practice all the measures, wearing the mask, social distancing. We will win this fight against COVID 19 together. And I hope everyone stays safe and stays strong. It is important to have good mental health. Please connect with your friends via social media and have good yoga and meditation to prevent anxiety during this difficult time. Thank you. I'm Dr. Shashank from 49. If you have any comments, you can write the comments in the comment section below. Thank you.